Cranial nerve number 2, what is it?
You got the optic nerve.
All right, so with the optic nerve, okay, is that sensory or motor?
That one is pure sensory.
All right, okay. So from the standpoint of pure sensory, okay, what we want to do is we want to check the visual field, out here, right? Because the way the eyes are, and see what his visual field is. Now, there's a number of different ways to test. I could stand in front and I could have him cover one eye and I could cover the same eye on my side, and then I could move the pen into view. And you may have to do that, okay, if a client is, proving, difficult to work with. But in this particular case, I have tested for years using the visual field. And what you do is you come right off the acromial process. So you're about 5-6 inches off here. And what you're gonna do is come from behind and you say to your client, okay, little J, what I'm gonna ask you to do is tell me over on this side when you see something out of the corner of your eye. And so I'm gonna come right up here and I'm gonna move. No, stop turning your head, all right? All right, you keep your head straight. See, that's what I do with my patient. I hit them on the head and I knock it off.
So head straight and eyes straight. You
don't want head straight and eyes straight.
You don't want them looking over like this.
Right, so good. So stop doing it. All right, so here we go. Let me know when you see it.
Now?
Seriously? All right, I'm gonna come over here on this side, okay? All right, and I'm gonna do the same thing on your right side. Are you ready?
Mm-hmm. Now?
All right. Pretty good.
And
well, maybe not. This one here was a little bit out further. You were a little slow on the uptake. And I know one thing for sure. I'm not going to be on the road when he's driving, especially if he comes up to a stop sign and I come up to a stop sign. I'm going to let him go first, because you know what he'll do? He'll broadside me because his visual field isn't the greatest on this side.
Now, and one thing I will say too is that, Big J mentioned that you might have someone who's not able to keep their gaze looking forward. So maybe you have someone with a stroke and they're not good at following the directions to keep their eyes looking forward. I might grab someone from the hallway, whether it's a nurse or a CNA, if you have a student, and make sure that they're standing or sitting in front of the patient at their eye level, making sure they're keeping their eyes forward so that you get a true indication of their visual field. And again, making sure that, because if you're behind them like this, it's hard to see what their eyes are doing. So if you have that second person, it can really help make sure they're keeping their eyes straight for the patient.